3 pages. Started your timing. Shall I go to the next page?
Yes, sure. Okay, ma'am. Okay, ma'am.
Started.
Can I start?
Yes.
Hello, I am Dr. Sija, one of the doctors in the antenatal clinic today. May I confirm your name and age?
Yeah, I'm Joycine and I'm 28-year-old.
How may I call you?
Joyce is fine.
Okay, Joycey, from the notes, I understand that you are 12 weeks pregnant and you are here to discuss the ultrasound reports with me. Is that right?
Yeah, doctor, I'm really very anxious because they were laughing while doing the scan, and suddenly they stopped laughing, and then they said, no, something is worrying, and the doctor will be explaining the report to me. I'm really worried about this report. I'm worried about baby.
Okay, I understand your concern, Joyce. At the outset, I would like to apologize you as well as Dr. Gupta is not available here at present. Is it okay if I discuss the reports with you and fix another appointment with the consultant later?
Yeah, that's great. That's okay, doctor.
Okay, Joyce, as it is our first meeting, is it okay if I ask you some questions before discussing the scan results? Or you would like to know the scan results first?
I would like to know the scan result.
Okay, Joyce, I can understand. I see that you are alone today. Do you want anyone else to be with you? As I have some concerning news to share, and I'm afraid that I don't have a good news for you.
Oh my God, what it is, doctor?
Okay, Joyce, your scan report is with me, and I've confirmed the name and NHS number. And
Mhm.
your baby, your heartbeat, the baby's heartbeat is there. The growth is fine. The water around the baby is everything is fine. But unfortunately, there is a huge swelling in the neck of your baby, and that is extending into the chest and the abdomen. In medical terms, we call it as cystic hygroma. Have you heard about it?
No, doctor, what it is actually? I haven't heard about it.
Okay, I can tell you. It is a condition in which there is fluid filled sac around the neck of the baby, which we call it as a cyst. And this happens due to some obstruction in the lymphatic system, which is actually a part of our defensive system or the immune system that usually drains the extra fluid from our body. Are you with me, Joyce? Are you following?
Okay. Yeah.
Okay. So usually this can happen as an isolated abnormality, and it can be part of a genetic defect in the baby also, and it can sometimes be associated with some structural abnormalities of your baby's heart also. And sometimes there can be due to excessive fluid collection of water around the heart, the lungs, and can be part of that also, and that we call as fetal eye drops. uh, are you understanding, Joyce?
Oh my God. Now what, doctor?
Okay, so if we will be managed by a team of doctors, my consultant, then we'll have a specialist baby doctors with us, and you'll be seen by a counselor, the scan doctor, and a genetic counselor if it is needed, and a baby surgeon. And we'll offer you referral to a baby specialist that we call as fetal medicine specialist, and they might do a detailed scan for you to look if the baby's organs are normal or not. And most probably they'll be suggesting a needle test to know if there is any genetic abnormality for the baby. As it is 12 weeks, what we usually do is a test, a needle test named as chorionic villus sampling, where we pass a needle through your tummy and to the womb, and we get a small portion of your afterbirth, and we can know whether the baby is having any genetic abnormality. Are you okay with the test, Joyce? Hello?
Actually, doctor, this is too confusing. I was not expecting all these things.
Yeah, I can understand your concern, Joyce. We as a team will be helping you out.
Okay, if I decide to go, is there anything else if I don't decide to go with this
Yeah,
test?
yeah, I can understand. There is actually a blood test also that we call it as NIBT, for in which your blood will be taken, and the genetic material of the baby will be in your blood, and that will be tested for if there is any abnormality. But I have to say that is just a screening test, and that is also not confirmatory. If it comes as positive, then we again have to go for the needle test. And if it is late, if it is after 15 weeks, then there is another needle test also that is called as amniocentesis, where the fluid around the baby is tested. But I should say that both of these tests have a miscarriage rate of around 1 in 200, and there's a slight chance of infection also.
My God, is my baby is going to be handicapped, doctor?
uh, Joycey, at present, we wouldn't be able to say about that. If it is an isolated abnormality, your baby might be normal. That can resolve as well, but only after. But if it is associated with a genetic abnormality or a structural abnormality, then there can be anomalies as well. Are you with me, Joyce?
Okay, when is my baby going to be die? I'm just worried about that. I don't want to have any abnormal baby, doctor.
We have two options for you, Joyce. If the results come, and we can give you two options, either to continue the pregnancy, or as well as some women even take a difficult decision to end this pregnancy as well. Whatever you prefer, we are here to support and respect your decision. Okay, Joyce, what do you want? Do you want to continue the pregnancy?
I'm clueless, doctor. I don't know what to choose.
Do you want some more time to decide on this?
Oh yeah, definitely. If at
Should I
all I
tell you?
continue, if I at all I continue the pregnancy, how it will be?
Yes, I'll tell you that if you're continuing, then we'll be referring you to the fetal medicine specialist. They'll be doing the needle test, and if everything is normal, then we'll do a detailed scan at around 18 to 20 weeks, and we'll be checking your baby's heart at around 22 to 24 weeks, and then we'll be doing serial scans to see if the swelling is increasing or disappearing, or how the baby is growing as well. And I'm sorry to say that some babies, mothers may lose their baby in the womb as well. I'm sorry. And
Okay.
regarding the
And how
delivery, we'll
if
be
yeah, and how it's going to get? treated, doctor, with this swelling? Do my baby is going to need any surgery? How the swelling is going to get treated?
Yes, yes, I can understand. Once the baby is delivered, that is usually we aim at a vaginal delivery, and sometimes if the cyst is very large, we'll have to go for a cesarean section as well. And if after the baby delivery, we'll be the baby doctor, the specialist baby doctor, and the baby surgeon will be seeing your baby, and they will decide on the management. Usually, a shunt that drains the fluid or excision of the cyst or an injection into the cyst might help. But if it is a large one that is causing breathing or difficult feeding difficulty, then a surgery might be needed. And usually, I would say most babies do well after this.
Okay. Okay.
Joints.
Yeah,
And
doctor.
yeah, could you tell me this is this your first pregnancy?
Yeah, doctor, this is my first pregnancy. Although me
Okay,
and my partner are together since last 3 years, we are not
okay,
looking forward to the baby. But this is an
okay,
accidental surprise to me.
okay.
We were at least
This
okay
was
to
not
go
a
ahead.
planned pregnancy, is it?
No, it was not a plan. But
Okay.
we were happy to go ahead with the pregnancy. We were not having any issue. This is
Okay.
totally come as a shock.
Okay. Can I ask you some more questions so that I can
Yeah.
understand you better? Yeah. But are you having any other diseases like medical, anything else for you for which you are seeing a GP
No, no,
or any surgeries in your tummy?
no,
What is your blood group? Is there any reservations?
no, no reservation. My blood
What is
group
your
is A positive.
okay? What is your weight to height ratio?
It's normal, doctor.
Your husband is supportive?
I'm not married. My boyfriend is very supportive.
Okay, okay, that is good to know. Is there, sorry to ask, do you smoke or use alcohol?
No,
Any recreational drugs?
no,
How are you feeling in the last 2 weeks?
no. I'm happy, doctor. I was really excited about this
Okay.
pregnancy.
Uh, okay, Joyce, I'll give you some more time so that you and your partner can decide on this, and you can tell your decisions to us. And after that, I can help you with with some patient information leaflets. I can provide you some numbers of the support groups. And if you need a counselor, we'll be connecting you to this counselor as well. And I can do a next appointment with the consultant and the specialist baby doctor. Is that okay, Joyce? Or do you have any other worries?
No, no worries. Thank you.
Thank you so much.
Yeah. So just half a second extra. Very well done. Very well done.
Okay, thank you, ma'am.
Yeah. So Dr. Srija or what it is? Srija.
Sija, Sija, ma'am. SIJ. Sija.
Okay, Srija. Very well presented. Very well done. Um,
Okay.
I'm really happy for the task, the way you had conducted it. Little means another 1 minute time if you could have saved and asked little more detail, because then in the end when you realize that you are not having time for information gathering, then you were rushing
Yeah.
actually.
Yes, yes, ma'am. I
Yeah.
actually was planning to do information gathering before management, then I forgot. That's
Yeah. Yeah. So once you have break the bad news, then only you ensure that you will ask the information and then go
yeah.
ahead with the management.
Okay, okay.
Okay. Yeah.
Okay.
Very well done. Anybody wants to comment on her performance?
I didn't ask about the
I mean,
drug allergy also,
excellent.
ma'am.
Because you
It's
were not
excellent
having time.
performance.
Yes.
So good. Well done.
Very well done. Muthulakshmi, would you like to give feedback?
Mom, she has done nicely. But one thing I felt is whether you want some time or shall I discuss in the next appointment when you told confused totally that
Yeah, she offered me some time actually. She offered me some time. So that is also okay. That is
okay.
also okay for me.
It's very well done.
Very well done. Very well done.
Thank you
Okay.
so much.
Yeah. Very well done. I hardly have anything to say. Yes.
Folic acid, ma'am. Folic acid, ma'am.
Yeah, folic acid. She missed out on folic acid. One thing. And another thing is that whether she's aware about that CVS and NIPT. Had she heard about this investigation? So that is checking, and then termination. Under what clause you are going to terminate? Okay, so that if you are going to end, so under what clause you are going to end? So that is an actually they wanted that in the information. Okay, so
Okay.
it will be under clause C, up to 24 weeks. We can end the pregnancy at any time with the help of two consultant, with the opinion of two consultant. Okay, so that one sentence I wanted somewhere else. Folic acid. Then rest of the things were very normal, means very good. I don't have any issue. Very smooth. It was looking like a consultation. It was not looking like a task what we are performing. Okay, so that is the best part about your presentation, Dr. Sija.
Okay, thank you so much.
Yeah. In the answer key, because I wanted this in the this task, the answer key suggests that you should be discussing the report first, and the patient is wanting you to discuss the report first, and you had means done exactly the way the role player were asking. So a clear pass, nothing else. In my answer key, I had a different format, but the book, and here I'm going according you have done according to the book and according to the role player what the role player was wanting. So clear pass. My role means my answer key is a straightforward answer key what generally we used to have, but in this format, if the role player is asking you to explain the report, you need to explain it. Very important. See to it that you will have some time for information gathering, and you may not have to rush it. Okay, my information gathering is very simple. These are the communication tasks. Okay, you just need to be communicative. You need to give patient a time to act, time to react, and communicate. Okay, so how you are going, so it was wonderful communication. Um this is not complete BBN. You had, because you yourself said in the big end, at the end, that most of the babies do well after the surgery or after the birth. So whenever the babies are doing good, then most of the time not having any mental retardation or anything, then that is a partial BBN. You follow the template of complete BBN. I am not taking it in. I am also not having any issue, but it is BBN. Okay, partial or complete, it is BBN. You followed the template. Okay, assess response of patient, understand you are using many a times. See to it, you if you can acknowledge her anxiety, acknowledge her worry, so those sentences will take your performance to the next level. Okay, check background knowledge, whether she's aware about that, what you want, whether you want to discuss it just now or not. Yes, I wanted to discuss the report just now. You discuss the report, then the information what I would have asked. Okay, here planned pregnancy, unplanned pregnancy. It is unplanned pregnancy, but then me and my boyfriend were happy to go ahead with that. Now here it's down screening has been done or not. Blood test. So
Right.
this was a NT scan basically. NT scan, there is a cystic fibrosis. Screening blood test. Okay, any fever, any family history of special babies in the family, folic acid. When are you corrected? Miss, are you 13 weeks from your last menstrual period, and was your period regular? Hmm? Any medication, because sometimes some medications do have association with congenital abnormalities. So that needs to be asked, especially antiepileptics, any other medication, medical history, diabetes, important, because diabetes is another important thing. Alcohol, smoking, BMI you asked, blood group you asked. I am allergic to cat. Okay, you missed out on allergy here.
I like.
Partial BBN, explain cystic hygroma, and before explaining cystic hygroma, you have to check her background knowledge. You had checked my background knowledge. Here the best would have been if you could have drawn something like a head and something like what I had shown into the diagram. Okay, so this will be, if the lay will be there, they will give you again full on full. Definitely they will give you, but then these are something which sometimes you will get them extra. Okay, so see to it, you will draw. Okay, so very nicely explained. A collection of fluid filled sacs known as cyst, which are resulted from the malformation in the lymphatic system. The lymphatic system is the system which deals with our immune system. Okay, why?
Okay.
The lymphatic system network within the body which form the part of immune system, they are abnormally formed at this point of pregnancy, and that's the reason this kind of swelling will be there. Why so? Why? No exact reason is there why this happened. Do you know that? No exact reason, but sometimes it is associated with some abnormalities, genetic abnormalities. Like you can show your knowledge here, a Turner's baby or Down syndrome, and it is most of the time it is associated with Turner. Okay, or Down syndrome sometimes could be because of associated with infection or some congenital abnormalities of the heart, as you rightly mentioned. Okay, cystic hygroma forms when the lymph vessel fail to form correctly during the first few weeks of the pregnancy. It cannot be prevented as it occurs very early in the pregnancy. Hmm?
Okay.
So chances of having cystic hygroma is 1 in 100. Out of every 100 baby pregnancy, one pregnancy will have cystic hygroma. Sometimes it is associated with abnormal chromosomal pattern like Turner syndrome. Have you heard about that? That is abnormal chromosomal syndrome. Then Down syndrome. This abnormal cardiac means heart problems. What implications? What it will have? This has been missed by you. Okay, so this is a swelling. You mentioned the risk associated. You mentioned the causes of this cystic hygroma, but how the baby will be, what the baby's outcome will be. So, if not associated with any genetical abnormality or any structural abnormality, this swelling may interfere with breathing and the feeding habits of the baby. That is an implication of this condition, which was missed out during pregnancy duration or antenatal duration. We will not be able to treat it. The treatment will be offered to the baby once the baby will be delivered. Hmm? So now coming to the management. So firstly, we need to refer you to the fetal medicine expert and genetic counselor to see whether there is any abnormal genetic pattern which can be identified by doing a detailed anomaly scan, a detailed scan from the fetal medicine experts, and offering you two options: either a NIPT, that is a blood test, which is having a very good chances of detection of abnormal chromosomal pattern, but then there is a limitation. This is again a screening test and it may need a confirmatory test, or a confirmatory test, that is a needle test, which will be offered by fetal medicine experts after doing a detailed scan, and that procedure is known as chorionic villus sampling. Have you heard about this condition? Okay, so here you can just explain her that under all aseptic precautions, the needle will be put inside your tummy through the womb, and some placental tissue or afterbirth tissues will be sucked out, and then they will be sent for the chromosomal analysis to the laboratory. Most of the time, the results will be available within weeks' time. Sometimes it may take time, but the risk associated with this procedure is the risk of miscarriages. Infection risk is less. Sometimes risk of not getting the desired report. Okay, mosaicism or something like that. So the desired report may not be available, and infection is a small risk which is associated with this. This is a confirmatory test. If it is if nothing has been abnormal and you decide to continue, okay, if the things are abnormal, then we do have option of either to end a pregnancy or to continue pregnancy. So what are your options, or what are your thought? What do you think? No, doctor, I don't want to have any abnormal baby because I can't deal with all those things. Yes, so in that case, if this, although everything comes out normal and still you are anxious, still you are not keen on get having this pregnancy, then yes, the option of termination is available. It can be done under clause C up to 24 weeks with the help of two consultants' opinion. So even if the baby is normal, means genetically normal, but if it is taking a toll on your mental health, we can end this pregnancy. So if she wants to end, she can end. But if she wants some time, we can offer here counseling. Okay, here you can offer. When I was telling you that I am confused, I don't know what to do. There you offered me time also, but at the same time, if you would have offered me counselor, would have been the best thing, because after you finished your 10 minutes time, you offered me counselor. So it will not be taken into consideration. So when I was telling you at that point only, if you could have offered me counselor, it would have been the best possible thing. Okay, yeah, people do find it difficult to decide at once. You can take your time. Meanwhile, can I arrange a counselor meeting also? Hmm? So that would have been the best possible way of explaining when I told you that I am finding it very difficult. I was not expecting all those things. If decided to continue, if decided, and then when I said about continuation, so if decided to continue, it will be multidisciplinary team approach, consultant-led care unit. Pediatric surgeon will be a part of this team along with the neonatologist, because the treatment is most of the time surgical, as you rightly mentioned. Sometimes removing the cyst, putting a shunt, giving some sclerosing agent, some chemicals may burn this cyst. Okay, but if it is a very big and interfering with your feeding and baby's breathing habits, then the surgery will be required, which will be done by the pediatric surgeon, and the outcome of the surgery is really good. Yes, so you have done everything very nicely up till now. Want some time, you can discuss with your partner, and you meanwhile you can see a counselor also and come back again. We will definitely have a consultation with my consultant. At that time we will discuss what will be, whatever option you want to go ahead, we will discuss that. Meanwhile, can I arrange you a fetal medicine expert's opinion urgently? Meanwhile, I was having 2 3 concerns. You answered me that yes, the chances of miscarriages and death are always high compared to the normal babies in this kind of babies. Okay, this is one question, because you were confused when I asked you, is my baby is having higher chances of stillbirth, baby dying in womb, or miscarriage? So at that point I think you were not keen to be very bold and say yes. You tried to use sentences, yes, if the baby is having some abnormal conditions, then yes. Oh, any abnormality, whenever there will be any abnormality, the chances of stillbirths will be slightly higher than the background babies who are having a normal structural and chromosomal pattern. So here you can just very politely say, yeah, we do see babies who are having any abnormality. The such babies do have bad outcome at a time. They may miscarry, they may deliver early, they may die inside the womb. Okay, so here you answered it very well. I am not having, but I thought you gave me few more explanatory sentences, not
Mhm.
so that I will not feel very sad about that sentence. Okay, so if normal genetic test then affect only feeding, and if it is affecting feeding and breathing, then the surgery will be done, and that will be done for surgically. It will not have, if will my baby will be handicapped at that time. Again, you were, what you said at that time, very elaborative sentences you tried to mention. Okay, you're very, so less likely the baby will be handicapped here. Okay, because it is just pressing the baby, so that's the reason implication is very important. It is just pressing the baby's neck, so your baby will be having a problem with the feeding and the breathing. It will not be making baby handicapped. Baby can walk, baby cannot, and if it is not associated with any chromosomal abnormalities, then the baby can have a uh, normal life. Okay, normal life as it is. Mode of delivery, yes, mode of delivery will be mostly we will aim for vaginal delivery, but if at all it will be interfering while delivering, then the cesarean section will be decided. This is antenatal result and choices is some one website link where they can find out people who are having some similar kind of situation, and there they can talk with the parents of the same thing. Okay, so that is something like website link I will say. Okay.
Okay.
Yeah, very well done. Now coming to the domain-wise scoring. High BMI, family history of obesity, irregular periods. No.
This is another one's information.
Yeah. This is not the one. Okay. Hmm. Okay. So in this case, if you want to see the information gathering is very simple. It will be whether the pregnancy was planned, unplanned. What are my concerns? Okay, what are my fears here? Whether it is, what are my views? Whether I want to terminate, I want to continue. What are my uh, Blood group is very important thing here. Allergy, so all those will be information gathering. In this case it will be not be this case. Okay. This is not the, I need to change it. Okay. Then communication, introduce yourself, explain, go through the process of breaking bad news. You had undergone that very nicely, you have done it very nicely. Explain the ultrasound report with the help of diagram. Huh? In the beginning only you have done it very nicely. Then explain the options. Prenatal testing, that is CVS, and if not willing for CVS, then NIPT pros and cons. Uh, if normal, if abnormal, what will be the course of pregnancy? That also you had mentioned. Discuss importance of continuing medication of folic acid. Discuss prenatal screening, monitoring of the fetus, and think of mode of the delivery. Okay, so all those will be discussed. So communication with patient and families, it's a clear pass. Colleague, fetal medicine expert, geneticist, counselor, fetal cardiologist, which you have mentioned, pediatric surgeon, and counselor. Okay, so genetic counselor, all you mentioned here. Also I am giving you clear pass. That counselor had come after 10 minutes, so be means you ensure that in the exam you will say early. Okay. And baby doctor and baby surgeon also, when you mention about MDT, at that time also you can say that the baby doctor and baby surgeon will be a part of this team, because that also means I was literally waiting for that baby surgeon you mentioned very lately. Patient safety, confirm patient's identity at the start of the task, empower patient to make an informed decision on the management, safe prescription, that is CVS and NIPT, takes into consideration allergies, that is CAT, respect the patient's wishes, autonomy, understand the cause of termination of pregnancy, offer to call partner, relative, or friend. This is a this book is saying according to this. So if you think whenever any such big breaking bad news, you can may ask, can I arrange someone to be with you right now? Okay. Or can I arrange some transportation back home?
Okay.
She may not be able to drive home or take in most of the what she's given. Okay. So this is, they used to offer some sentences like this in the beginning, very beginning, but nowadays I don't think, I don't know what is the status. Okay, so associated aneuploidy, that is 45XO, screening the structural abnormalities, especially cardiovascular. Surgery of for unexplained prognosis, guarded as baby may be syndromic. So if nothing is, everything is normal, no abnormality in the heart, no abnormality in the genetic thing, then the baby, we can reassure that okay, the baby will be normal. No, you do not have to worry. Then the knowledge about prenatal diagnostics testing, that is CVS. Here CVS basically, not amnio, CVS and NIPT. Okay, so very well done. Okay.